Technological innovations. According to Merriam-Webster, the definition of technological is having special and usually practical knowledge, especially of a mechanical or scientific subject. And the definition of innovation is the introduction of something new. So therefore, we can say that technological innovation is the introduction of something new by way of using special and practical knowledge of a mechanical or scientific subject. In the case of this presentation, the focus will be on technology and the way that it is used among advanced practice nurses. Below are some examples of technological innovations. The first 6 on the list are from 2018, so they're things that we're actually already doing within the hospital setting. We have payer-provider analytics. This is a Yelp system for doctors, so physicians or patients are able to go online, type in a certain physician or specialty, and then see what other people and other providers have to say about that certain person or specialty. We have patient engagement. Studies have shown that patients prefer to use technology to interact with the facility that they stayed with or that they go to on a monthly or yearly basis for their medical care, that they prefer to give feedback via technology. Centralized monitoring of hospital patients. This is a second set of eyes, a safety check, as you will, for nurses within a hospital setting that have a lot of alarms going off constantly. This centralized monitoring decreases alarm fatigue and allows for an increase in patient safety. Hybrid closed-loop insulin delivery system. This is an artificial pancreas. It has monitors and electrodes that go onto the patient's body. There's a little cell phone-like device that constantly reads the patient's blood sugar and then delivers insulin if needed, just like your pancreas would inside your body. Then we have non-invasive diabetes monitoring. I've seen this a few times in the hospital. It's a little sensor. You can put it in the back fat of your arm, and you have a little handheld gadget, and it scans over and it tells you your blood glucose level. We have 5G mobile technology. This is similar to 4G. It has a better signal, a better strength, increases the ability of broadband that's being used, and they are working on video devices that allow for doctors to see patients better and to be able to assess them better in a home setting. Then we have electronic ICU. This is another second set of eyes. So if you have an emergency within the ICU, or you have something that you have a question about but you don't want to call your physician, or your physician can't be reached, you're able to call this system, and they're able to see the patient via video monitoring, and they're able to help you with whatever you need help with. And then of course the physician order entry system. This is computerized order entries. This is something the entire country has moved to and is shown to improve and hurt care in some situations, some areas, based on the type of order entry system that we choose to use. Some of the benefits of technological innovations are reduced emergency room visits, reduced hospital admissions due to the ability of alerts and reminders, and also due to the ability of being able to Skype with physicians from your home setting instead of going into a facility. Decreases the opportunity for human error due to automations. We have these automatic processes through computer systems that have hard stops or that throw up alerts if we're going to possibly have an error in something. Allows for computer-enabled calculations for medication doses. This is something that the pharmacy probably uses a little more than anyone, but definitely can use it in the nurse setting, especially in the APRN setting when you are trying to calculate dosages for prescriptions. Improves medication administration safety. This is barcode scanning, hard stops that don't allow you to give things that the patient may have an allergy to. Then we have allows for order clarity, so the physicians can put in their order and they have a whole host of things to select to make sure that everything is in order and looks as it should instead of reading someone's handwriting. Able to track and extract performance data regarding patient care. This goes for the hospital and for physician offices. Information can be shared across multiple care settings. So within a system, you can go to your primary care, you can go to the ER, and those two physicians can see what you went there for and what was said about you. Same for x-rays, CT scans, things of that nature. They can read all of those things in one system. We have e-prescribing. That decreases the time patients wait for prescriptions. It also decreases the chance of prescriptions being lost or not picked up at all. We have patient portals. This is how patients can speak to their provider without having to call the office, and they can do it at any time of day, whether the office is open or closed. And then we have the ability to speak with a physician from the privacy of the home setting, which is new that the insurance or companies are doing, where as part of your policy that you can call into a company and they have a physician there that will speak with you if you have a medical need. Some of the limitations of technological innovations may be significant cost to primary care practices, especially when primary care practices are moving from paper systems to electronic systems. There's some automatic costs there that come with buying technology. And then you may have people who don't understand technology and how it works, or maybe they need more specialized training in order to use certain systems. So that is also a significant cost. There's no automatic translation of improved quality care. So we don't automatically see an improvement in the way our care is being provided just off of using technology. We still have to do studies and processes and things of that nature. There's an increased amount of medication errors. There's a study that shows that if you are unable to use the system or the process and you don't know how it works, that you actually increase the amount of errors that you make because of your inability to use the system. And then setup of processes within certain computer systems that may allow for errors. So some systems may not have the ability of hard stops, or they may let you override certain types of scanning that would otherwise be something that you would do for patient safety, and those things may allow for errors. We also have privacy concerns, so anything technology, you have all kinds of hackers out there, and so privacy is a large issue there. And then inabilities on the user interface. This is more of how the screen may be set up or how many things you can look at one time. When you have papers in front of you, you can look at all of them at one time, but the screen with technology may not allow for that type of interaction. The effects of technological innovations in primary care are improved post-hospitalization follow-up care and improved hospital readmission rates. This is due to the ability to have electronic notifications for patients to realize that they have a follow-up appointment. It allows for them to reschedule an appointment via the patient portal or another electronic source, so that way they don't miss follow-ups or follow-up labs, and then they have a less chance of being rehospitalized and less chance of not seeing the primary care provider post-hospitalization. Then we have e-prescribing. This helps the patient get their prescriptions a little easier. The prescription's normally waiting on them by the time they get to the pharmacy. Patient portals is how patients contact their primary care provider or vice versa. Then it decreases the opportunity for human error due to automation. So we're able to see that computers used in primary care setting have hard stops or have the ability to calculate medication doses or even have a way of alerting you if something has been put in incorrectly. And then it also allows for order clarity. So we're not reading someone's handwriting and trying to guess what they want or what they're saying. We're able to see it on the screen as is meant to be ordered. Utilization of technology by the APRN is e-prescribing, speaking with patients through the patient portal, verbal dictation versus typing, creating follow-up appointments with notification systems, and software that records vitals, heart rhythms, etc. via a wearable device.